able to get in. I gotcha. I see. You should be coming in a different way. I need to show you how to do that.
Okay.
Okay, now it should be up.
Through the back door.
Yeah, you should go in through studio.youtube.com. We'll have to sit down. I'll show you how to do that one day. Okay, you in now?
No, for some reason it's
Should say Weird Medicine Live Podcast recording, all super chat questions answered. You may need to go back out and come back in.
No, I just did. Yeah. I've done it 4 times.
Well, I'm looking at it.
Come on, baby. Yeah, and everything else on there, Steve, seems to work. I mean, internet's fine. Everything else on YouTube's fine. Weird Medicine Live Podcast. Yeah, I've still got the one from last week. And I've come in and come out and refreshed. And
it's unlisted. That's why. Okay, I gotcha. You're right. Hang on. Okay, try it now.
Okay.
Hello.
kind of just wave at you or point or?
Well, you can just, at any time during the show, you can say, hey, we got a super chat from so-and-so. We have a question from the super chats.
Gotcha.
That'd be the way to do it.
Gotcha.
People don't like when the show is interrupted, like by, ooh, hey, we got a super chat. Thanks for the $2. But if it's people sending super chats that has a question on it, we'll answer those during the show.
Gotcha.
And then, now where's that coming from? Why am I hearing us?
My computer's muted.
Oh, I know why. Because I've got it over here. Okay, and then the other thing is, see that, Chris?
Mm-hmm.
That's Tasha's boyfriend, Chris.
Oh, cool.
Chris Cantu, so, he's joined the Fluid family. So at the end of it, I don't want to do that during the Sirius XM show.
Okay.
We'll answer questions, but at the end of the Sirius XM show, then we'll go back and we'll read all the super chats.
Should wait to the end. Gotcha.
Unless it's a medical question. If someone asks a medical question that's appropriate for the show, we'll do that during the show.
Yeah, but do we identify them as being super chat?
Yeah, you can. You say, hey, we got a question from the super chats.
Gotcha.
That might encourage people to do it.
That's what I was thinking.
Okay?
Yep.
Does that make sense?
Yeah, I think.
Okay.
We'll
All
give her
right.
a shot.
Okay. Taste, can you test your mind? Taste.
Hello.
All right. Okie doke. Sorry about that. I knew that was a lot.
It's
but
fairly painless.
It's new.
Relatively painless. I'll tell you, my nuts are so cool right now.
Oh, I'm so happy
good.
for you.
What little bits left? Atrophied, retracted, normal stuff.
Okay. All right. You ready?
Well, I think so. We'll certainly figure it out when we.
Okay.
I have two
One way or the
small
other.
articles, Steve.
Okay.
Sirius XM. It's time for Weird Medicine with Dr. Steve.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve exacerbating my incredible woes. I want to take my brain out, blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. Like aging
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And got my partner in all things, Tacey. Hello, Tacey.
Hello.
Well, your camera is just pointing at the wall. Oh, well.
Good.
Perfect.
This is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Don't forget Dr. Scott's website at simplyherbals.net, simplyherbals.net. Everything going okay there, Dr. Scott?
Everything is good, Dr. Steve.
All right, sounds good. That darn fan has got to go.
Oh, no.
Sorry.
Too much noise.
Good Lord. Yeah, I'm gonna run that back.
And you're going to
That's
hear
horrible.
some cussing.
Yep.
Hang on.
Almost have
That was
sweaty nuts
terrible.
now.
Terrible.
You bragged about it too much,
I
and
did,
now
didn't I?
look what happened.
Well, I think
Said
now,
no said a word.
hang on. I'm gonna start right there.
Uh-oh.
It's okay, Steve. We just need to get started.
Yeah.
Oh, okay. Can you deal with that?
I don't. No, we don't have to have a fan on.
No, it's fine. That much is okay.
Okay.
It's just way too loud. I was editing one of the shows the other day, and it was like, that's got to stop.
We're good.
All right. Hang on. Don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. Everything going okay over there, Dr. Scott?
Yes, sir. Super great.
I'm going to need some more CBD nasal spray pretty soon, so I will be placing an order. I went over to Dr. Scott's house the other day, hoping that he might have some just laying around, but he's too professional for that.
I had it in a secret stash.
That's all right. Check out drsteve.com for all the stuff that we talk about on this show, including you can go to stuff.drsteve.com, and it has all the things like the Rody tuner and the Navage and all those lovely things that we have reviewed on there as well. So anyway, all right, very good. Well, it is that time, I think. Tacey, you weren't here last week, so everyone's
No.
been missing this.
Oh, yeah.
It's Tacey's time of topics. A time for Tacey to discuss topics of the day.
Or to go
Not to
potty.
be confused with Topic Time
If
with
you need to
Harrison
go
Young,
potty.
which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey.
First of all, I would like to apologize for the breast staring equals exercise.
Oh, yeah, we covered that. We covered that
We
last
fell
week.
for that, and I am glad that it's not true because I was really thinking the other half of the world was a bunch of perverts. So,
That's true. That has nothing to do with that news story. The fact that men ogle women's, mammaries. When you think about it, what is the deal? I mean, it's like that's where if you were a kid, not in the 50s, where, breastfeeding was gross and they would, gave us this horrific formula. What is it about boobs that are just so fascinating?
That's a good question.
I don't know.
I don't know either.
I don't know.
Kind of a weird question.
It has to do with procreation and all that stuff, and it's like, why are we? Half the problems of the world are that our ancestors couldn't figure out the world, so they had to come up with some framework to make the universe make sense, and we call that religion. And now we got all these different religions, and so because of geographic separation, that we have problems with each other because of that. And that's the old joke of the they go by the room in heaven, and there's all the Baptists in there, and they say, don't tell the Baptists, they think they're the only ones here. That kind of stuff. There are no denominations in heaven, certainly, right? So, so we have those divisions. And then the other divisions that we have in this world is the fact that we have this binary existence where we procreate between people with XX genes and people with XY genes. And that procreation drive is it's nuts. And so, I love seeing a large-breasted woman with a small waist and that tit-to-gut ratio and all that stuff. And
all right then. So let's
okay,
go ahead.
Fuck off. Don't be you're not the hole on the show. You're our partner.
You're the expert in
Yes,
things.
you're the
only one
expert on this.
You're the only one with those things.
But who, where does that come from?
Mm-hmm. Yeah, that is a good
If you
question.
really think about
I've
it.
never thought about that a single time.
Yeah.
Well, same goes. I mean, what do women look like? They don't look at our.
No, they look
at shoulders.
They look at
or
our shoes.
hair.
They look at our shoes.
Yeah.
And you know how I know that?
Uh-uh.
Because at my wedding, my best man forgot his shoes, and I said, "They're just black shoes. We'll go to Kmart."
Yeah. Who cares?
And we'll go to Kmart. We'll buy a pair of black shoes. You only got to wear them once. So we show up at the wedding, and his wife sees him, and without skipping a beat, where'd you get those shoes?
Oh, for God's sakes.
It wasn't.
Who cares?
She hadn't seen him 5 seconds. She already knew that the shoes were not the shoes that he was supposed to be
Oh,
wearing.
my gosh.
No,
That's got to be some kind
Casey, you can speak to
That's
that.
a whole nother evolutionary kind of thing.
Well, your
that-
shoes were pathetic when we met. They were really awful.
They were not.
They were
Our,
unbelievably terrible.
he had great
There
tennis
were holes
shoes,
in
as
the
I
bottom
recall.
of
though.
them.
How can shoes
The
be?
tassels were gone. I took
Tassels.
them to the shoe place for him to fix them, and he looked at me like, "What do you want me to do?" And I just said, "Do the best you can."
about you
And
just
they still looked like shit.
buy
And he
new
did the
shoes?
best he could. And so we went on a shoe journey. We've been on a shoe journey for 20-something years now.
Shoes.
I don't. Yeah, I was trying to think back all those years ago when, because I guess you wore tennis shoes around.
No, that's
The old clinic.
That's after the tassel.
Oh, was it okay?
Yeah.
Tassels. They were removed because I probably yanked them off of there because who wants tassels on their shoes?
Oh my God.
Nobody cool.
If
Now,
they're
I-
supposed to have tassels, then they need to have tassels.
I will say that one time I was walking in Chapel Hill, and I used to drive my mom crazy because I wear these loafers until they were, like Tacey said, they had holes in the bottom. And I wore these shoes, and this is so bad. And I was walking to a bar in downtown Chapel Hill on Franklin Street. And I remember this like it was yesterday. I was walking past the Radio, Television, and Motion Pictures building where the RTVMP department was, and the front half of my shoe just fell off. The whole underneath, the hole underneath the sole was so big that the whole thing just broke off.
And he probably wore them the next day.
No, I couldn't wear them. And I was
love
like,
it.
fuck, what am I supposed to do? So I just walked around barefoot for a little while, and then I bought some new shoes. So that's what you're supposed to do. You wear them until they wear out.
Well, when you were streaking, you didn't need shoes, so I can certainly
Oh,
appreciate
No, that was
that.
the one thing you did have. It was weird too, because if you're running in loafers and then knee-high socks and you're naked from the knees up, it kind of looks stupid. And then, of course, I had on, people who know this, listen to the show, I also had on a tie and a Groucho Marx mask. So, anyway.
All right.
Yeah. So, Tacey, we did the mea culpa for that one. And the other thing I wanted to tell you guys was we almost didn't get to run either one of those shows as podcasts because I have a cleaner that says, do you want to get rid of large files? And I was running out of space. Okay. And I looked at them and I was like, yeah, we're not going to use any of those. So it deleted them all. Well, shit.
Oh, gosh.
It was the last 12 shows that we
goodness.
haven't posted yet. But for people who listen to the podcast, we haven't posted on a regular basis in some time because I'm trying to get out from under the laugh button and get out on our own.
Gotcha.
And I didn't want to give them any more shows than I had to because they were putting ads on them that I didn't agree to and stuff like that. So I'm finally got our podcast hosting company to transfer us out onto our own so we get to keep the revenue, such as it is. Mm-hmm. And then I can start putting those shows up. Well, I went to put one up the other day, and I couldn't find it, and then I couldn't find it, and I couldn't find the one after it,
Oh,
and the one
goodness.
after it, and they had all been deleted. So I was freaking out. So last week's podcast was just cobbled together from the files that I did have left over that was basically a published show. And I was like, I guess we're just going to have to do that for a while because I really did want the breast story and then our retraction to get out there. And then thank God for Dropbox because Dropbox was backing everything up. And when I deleted it, it went into a deleted file. And they're like, you know what? If you delete something, we're just going to hang on to it
Just
for
for a
30
little
days,
while.
just in case you fucked up. And I was like, thank God,
Yeah, that's
because they were
awesome.
all in there. So people who listen to that show, I'm going to put a preface on the next one saying I think everything's going to be okay. So thank goodness we got all those shows back, because I've been holding them back for a reason. I didn't want to not ever publish them. So anyway,
Right on.
all right. Well,
Cool.
thank you. Okay, so Taste, what do you got?
German swearing hotline lets callers blow off steam.
Hmm.
Two German entrepreneurs have devised a way for passive-aggressive citizens to blow off some steam. Dial a telephone number and give the person on the other end a verbal lashing.
Really? You Schweinhund.
The swearing hotline, known as Schwimmfloss, or swear away in German.
Say that again.
Shrimp floss.
Schimpfloss.
Schimpf.
Schimpfloss.
Awesome.
Has operators
I
standing by
didn't think them little critters even had teeth.
7 days a week for frustrated individuals to jeer at and taunt using the most unsavory language they can muster. We don't judge people who are angry, said the person who set up the hotline. It happens. It's natural. With us, you can blow off steam, no strings attached. The creators of the service found inspiration in their own stressful daily routine. The way Schultz sees it, he is doing people a favor by providing a release of pent-up aggravation and helping to avoid altercations in the workplace or home. If you're stressed out at work, you go home and your partner gets an earful, even though it's not her fault. When callers are not creative in their cursing or find themselves tongue-tied, operators on the hotline prod them by saying, "That's the third time I've heard that today. Is that all you've got?" The service costs €1.49
Yeah, you
per
paid
minute,
for it.
and they feel that's completely justified for getting everything off your chest. It's a bargain.
That is, I bet just listening to some of those people cussing would be hilarious.
Especially in German.
That
you
would,
know that's
that would
funny.
be hilarious.
Yeah.
yes.
Yeah, here we go. Let's see. I got
That
some.
is fun.
Ich will Tournament spielen! Los! Starte das verdammte Spiel!
She sounds pissed.
Starte das Spiel, du Hurensohn!
It's a kid playing a video game, and he's pissed. He's probably saying German gamer words, if you know what I mean.
Oh, my, that's funny.
So anyway, I wish we had one of those here.
That is
So.
great.
We could, we do. 347-766-4323. Feel free.
Could call Pooh Head.
Yep.
Weird health news. This woman's hair follicles sprout fingernails instead of hair. One day, 3 years ago, this lady
Some
named
kind of keratosis. What's that?
Shania Issam had an allergic reaction to steroids she'd been given after an asthma attack. The next day, she had a debilitating disease that was eating away at her skin, and experts had no idea what the disease was. They still don't know what it is, but they know what it's doing to her.
And what is it doing to her?
Okay, well, let's get there.
Oh,
For
okay.
some
It
reason,
sounded like you were
she
done.
produces 12 times the number of skin cells per hair follicle. It suffocates her skin and makes her follicles grow hard fingernails instead of the usual hair. This disease has been crippling, and she now has to get around using a cane. Luckily, doctors have been able to control her symptoms, if not solve the mystery. Right now, she's the only person in the world with this illness.
Wow.
Wow.
And she's facing the bills to prove it. Her in-state insurance only covers some of her medications and the medical treatment she's received locally. But she has to travel to Johns Hopkins in order to get specialized attention. As a result, she's now $250,000 in debt. She set up a foundation to help defray the costs and says, if my condition means me dealing with this to help someone else, I'm willing to go through it.
Wow.
Jeez.
Well,
That's insane.
And
in
that
the membrane.
concludes Time of Topics.
very
for
good.
today.
Thank you.
Good
Those
one,
are good
Dave.
ones.
Very good.
I've got something that's sort of similar to that, except different.
Same, except different.
Yes, there are things called cutaneous hair splinters. And what this is a fragment of hair penetrating the skin can grow under the nail, and these people have hair growing under their toenail, and it comes out the end of the nail. And so they got a hair follicle that got turned down and then started growing under the between the nail bed and the nail.
Yikes.
So how do they take care of that?
Well, you have to
Laser it or
remove the
something.
nail and get rid of that hair follicle if you want to get rid of it. Cutaneous hair splinter. What do you think of that?
Isn't that wild?
There you go.
Never heard tell such.
No, I ain't never heard tale of such. All right. You want to answer some phone calls?
Yeah, and I've got a fluid family question.
Okay. Oh, yeah.
If you want one, it's pretty good. It's actually a good
What
one.
you got?
Yeah, so I've got an ophthalmology question. Can I reasonably lower my inner eye pressure through diet and exercise, etc., without surgery? I guess the ophthalmologist is wanting to do a iridotomy with laser to lower the pressure in the eye.
Wow.
So, well, I was going to say diet and exercise have been shown to help with eye health, but not necessarily. I've never heard of it lowering intraocular pressure. But eating.
So
a
let's
healthy
talk
diet,
about glaucoma for a second.
okay, yeah.
So it is increased intraocular pressure. It can be caused narrow angle or wide angle. There's two kinds of glaucoma. It depends on the mechanism, what's causing that. And really, there are eye drops for it, and there are oral medications, but I'm not aware of any lifestyle changes that'll fix that.
not fixing
Because it's kind of a mechanical problem more than it is anything else.
Well, in my understanding, you can lower pressure just a teeny bit with like elevating your bed like 20 degrees.
Sure.
And like I said, exercise and not eating diets high in sugars and processed foods can help with eye health. But I've never heard of lowering the pressure.
Yeah.
So this is certainly going to be, or it sounds to me like a medical thing with the medications, drops, and possibly surgeries.
Yeah. And you really don't want to dick around with it because when glaucoma causes damage, it can't be reduced.
Yeah.
And so there are different eye drops that you can use. One of them is a prostaglandin eye drop, and that increase the outflow of the fluid in your eye that reduces eye pressure. So those are like Zalatan and Lumigan and those things. There are beta blockers. They reduce the production of fluid in your eye, and that would be like Timolol, that is sold as Timoptic. And then there's the alpha adrenergic agents. These reduce the pressure of the fluid that flows through the inside of your eye by increasing, again, the outflow of fluid into your eye. So, to get rid of the fluid. And that is like brimonidine, and that's Alphagan. Then there are other things, carbonic anhydrase inhibitors, and they reduce the production of fluid in your eye. Azopt would be the one that is most people are familiar with. And then the one that came out since I've been doing medicine are the Rho kinase inhibitors, and they suppress this enzyme that is responsible for increasing the fluid in your eye. And it's called Rho kinase, and it just suppresses that. So if you need Rho kinase to make fluid, and then you block the enzyme, then you don't make any fluid.
Right on.
And there are some of the old pilocarpines and those things. Those can only be used in certain types of glaucoma. And some of these eye drops are, absorbed into your bloodstream, et cetera, et cetera. There are oral medications, and the main one is that carbonic anhydrase inhibitor, and that can cause, diuresis, frequent urination, tingling in the fingers and toes, stomach upset, and other things like that. So. Yeah, it's kind of poopy. And then, then the treatments, you normally would do laser treatment. It's called laser trabeculoplasty. It will work if the eye drops don't work. And they just Use the laser to improve the drainage of the tissue located at the angle where the iris and the cornea meet, and basically just putting a hole in there
Right.
so that the fluid can flow more freely. And then, then there's the more highfalutin stuff. So now, if you have angle closure glaucoma, that's a medical emergency. And though that you can't dick around with, okay? And these people have this thing called a peripheral iridotomy, where they put the hole in the iris, and that's an emergency. Those people will lose their eyesight if they don't do it. But those are the minority of patients.
Yeah.
All right, okay. So yeah, just don't fuck around with that. If they're recommending that you do something, then, please do it, because the glaucoma isn't something to goof around with. If you have open angle glaucoma, you won't have any symptoms in the early stages. They will notice it when you go in to have your eye exam, which is why you need to do these. And they do a thing called tonometry, where they either, hit your eye with a puff of air and look at the resistance or the amount that comes back. Obviously if your eye is more gushy, then less will bounce back, right?
Sure.
And then, or they will numb it up and actually put a probe on your eye and feel it.
Gotcha.
And then as it gets worse, you'll get patchy blind spots in your side vision, your peripheral vision. And then as things get worse, then you get tunnel vision. Now, the angle closure glaucoma is the one where you'll get a severe headache, eye pain, nausea, vomiting, blurred vision, halos around. You'll know that you have it.
You'll know you're in trouble.
And sometimes this will happen when people take certain drugs and they didn't realize that they were prone to this. So, okay.
Great question, man.
All right. Yes, very good. Anything else from the family of fluids? And if you want to join the fluid family, we usually record Saturday at 1 p.m. on Eastern, but you just got to follow our Twitter at Weird Medicine, or go to our YouTube channel, which is youtube.com/@weirdmedicine, and just sign up for notifications. You can even join, and we do members-only events coming up and stuff like that, so it's loads of fun.
Cool.
All right. And it's a very cohesive group in there. Nothing else from them, because we've got some voicemails.
Yeah, no, voicemails sound good.
Okay, sounds good.
Number one thing, don't take advice from some asshole on the radio.
Hello, Dr. Steve. This is Mike from Buffalo.
Hello,
I have
Mike.
a question about nosebleeds.
Okay.
So I'm 42 now. I've been having nosebleeds since I was in the 4th grade. I forget how old that is. But
Okay.
Well,
yeah, I
depends.
remember one day in school, my nose just started bleeding.
Depends. For you, maybe a
And
little,
I had to go
older.
to the nurse or whatever because I didn't know what was going on. And
Yeah. Just take your grade and add 5.
Right.
That'll get you. You will have been that age at some point during that grade. So if you're in 4th grade, you'd be 9.
long story short, a few years later when I was in 9th grade, I had such a bad nosebleed
14.
that it wouldn't stop. I had to go to the emergency room. Then I went to a specialist and an ear, nose, and throat guy. They told me my issue was too close to the brain to be cauterized.
Wow.
So this was when I was when I was in 9th grade. So however old that is.
Okay. Again, 14.
And then so they put tubes in my nose for like a month. I was taken out of school. I had these like tubes in my nose
That had
for
to
literally a
suck.
month, and they took them out, and finally it stopped bleeding.
Okay.
So, long story short, my whole life they always told me to,
Okay. He says that, but that's already not true.
when my nose bleeds, stop it with a tissue and look up, like lay down and look up. And eventually it would stop. And I've never had a bad nosebleed ever since that, when I was in 9th grade, that many years ago. Well, sometimes I still get them now as an adult. And one time I got them in a bad situation. I was actually at a wrestling pay-per-view when I got the nosebleed, so I had to go into the bathroom. And, I really wanted to get back to my seat, so I said, fuck it. Went to the stall, and I blew my nose for the first time while it was bleeding.
Okay.
And I didn't know if that was going to do anything bad. And long story short with that, it stopped bleeding. Whenever I got out in like 30 seconds, and then I was able to move on with my life.
Okay.
So now every time my nose bleeds, I just blow it out.
Okay.
And
Well,
it stops within 30. Like I said, however long it takes me to blow everything out, and then it stops.
okay. I don't know. I mean, this guy's having what sounds like posterior nosebleeds. So there are two kinds of nosebleeds, and we call that epistaxis. And the anterior ones are obviously in the front of your nose, on the septum. Okay, that's the thing that separates your nose. And there's these capillaries there, and if they get dried out, particularly, they will crack and the mucous membrane will bleed, and you'll get a nosebleed. And kids have this more than adults do because their septum is smaller and they're gross and they're picking their nose and all this kind of stuff. Yes. Now, the posterior nosebleed is deep inside your nose. That's why he was saying that they said it was too close to his brain. And it will drain down your throat. And so people sometimes will cough up blood. They'll get heavy bleeding. There's lots of blood supply back there. And so when they put the tubes in his nose, they did what they did to Tacey. You remember when you had your thing, Tace? And they had to take these gauze pledgets and basically just shove them up there. And we have these things for posterior nosebleeds that you put up people's nose and it just expands and puts pressure on it. And then, you got to leave it there for a long time. And it has to be a material that isn't going to then be stitched into the nose.
Stuck to the nose.
So gauze by itself is a terrible
idea,
because the blood clot will form into the matrix of the gauze. When you pull it out, it'll just yank everything out and it'll start bleeding again. But anyway, so they'll sometimes use Vaseline gauze or they'll use plastic tubes. There's all kinds of things that they can do. But why, when he blows his nose, it goes away, I don't know. He needs an ear, nose, and throat person to look up into his nose and see what in the hell is going on up there. Wow. And he may just have a deviated septum. Now, that usually causes anterior nosebleeds. But if you think about it, so you have the nasal septum, right? It goes straight back. If you think of a chimp nose, if you look at it, they don't really have a nose. They just have a hole in their face, and there's two holes that go straight back and a cartilage separating the two. That's the septum. Right. Now, in humans, our septum is pretty long. Dogs, it's even longer, a lot of dogs anyway. And if you get punched in the nose, the septum is going to wrinkle. And so it'll be an S-shaped. So it may be S-shaped toward the right or the left. The first curve and then the second curve will be behind it. So it'll curve one way for half and one way for the other.
Scoliosis of the septum.
Yeah, yes. It's an S-shaped septum. So when you breathe, when you pass air past a curved surface, if you remember your Bernoulli's principle, there will be decreased air pressure on the side of the curve. There will be more rapid airflow because it's got to go
further distance.
It has to go a further distance in the same amount of time. And what that does is it'll dry out the septum on that side, and then it will crack and it'll bleed. So, so those are if you have a deviated septum, you may be more prone to nosebleeds. Now, maybe his is curved far in the back, and that's why he's having these posterior nosebleeds. But he needs to see an ear, nose, and throat doctor. Let them just look up there with a fiber optic scope. They'll spray cocaine in your nose, so that's good.
Great.
And you'll breathe better than you've ever breathed in your life. And then they can look up there and see what the problem is and see if it's something that needs to be fixed. You could have a polyp up there or multiple polyps. You can have all kinds of crap.
Yeah, I was going to say he might just have something that's genetic.
Sure.
Causes his
just he's got a plexus
very superficial blood vessel thing. They might be able to
blood vessels. They could just cauterize it now. Maybe back in the day they couldn't. They didn't feel comfortable, but now they can.
However old he was in 4th grade.
So recreational drugs can do this.
Sure.
Cocaine will constrict the blood vessels of the septum to the point where if you use it every day over and over and over again, the septum will just die because it has no blood supply. And when that happens, you get a nose in your septum. And those people can stick their finger in their nose and have it come out the other side. They can do all kinds of stupid stuff. So they'll end up with an actual hole in their septum. Chemical irritants, high altitude, where the air is just drier because it can't hold moisture like it does down in, say, New Orleans, where it was when I lived down there. As soon as you walked outside, you were soaking wet in the summertime. And then, like I said, the deviated septum, and then nasal sprays. Certain nasal sprays like Afrin and stuff like that will dilate those tissues and constrict the blood vessels and can cause nose bleeding as well. So one thing that you can do with this is just get some Simply Saline. I love Simply Saline. It is salt water that's buffered for the nose, and it's under pressure. And you put your head down, stick this thing in your nostril and spray, and then snort it back. You'd think it would be really uncomfortable. Because it's properly buffered, you can't feel it at all. You know there's fluid going up there, but it doesn't cause burning or anything like that. And then you can just keep everything moist up there and then blow your nose and get all the lovely, allergens out of there and stuff. It's very helpful for chronic allergies, too. All right? Mm-hmm. You like that one?
That's good.
All right. Good. All right, let's see what we got here. Okay. This is from 2021.
Okay.
So I'm going in reverse order. We still have some from 2014 to do if we want to do them. So.
Hey, Dr. Steve, this is Ben.
Hey, man.
Just kind of curious about whenever, I guess you say ejaculate or whatever.
Yeah.
You see it a lot on, porn or whatever websites, real white. Mine's kind of somewhat yellowish, looks like.
Yeah.
Didn't know if that was just what it was landing on or whatever, but holler back, 903.
Well, okay. Hey, man. Yeah, so ejaculate in porn films is often not actually even ejaculate. We had a male adult film star on this show that told us a secret that they sometimes use Cetaphil to simulate ejaculation, particularly when they're doing like bukkake shots and stuff like that. And that stuff is just whiter than white. Now, if you have yellow semen, you may just have old semen. You may need to just clear out the pipes more often. There is a protein in semen called seminogelin that will, what it's there for is to gel semen once it hits the inside of the vagina around the cervix. So we very often forget that the purpose of of intercourse at one time was to procreate. And so when you ejaculate into a vagina and there's a cervix there, the seminogelin is supposed to gel and cause the semen to be more viscous so that it won't just drop out when the woman stands up. Mm-hmm. And if you leave it in the seminal vesicles long enough, it'll start to gel in there and it'll turn kind of yellowish color, and you may see things that look like tapioca when you ejaculate, and that's just basically coagulated semen. So so that could be what's going on.
Okay.
Did you find anything else out on yellow semen? I mean, I guess you could have an infection that could cause yellow semen.
Yeah, that'd be my only other cause, prostate infection.
But you would think that you would have some other symptoms with that. Prostatitis, some sexually transmitted diseases, urinary tract infections will turn semen yellow, but you'd have symptoms with that. So if you have fever or pain when you urinate or when you ejaculate, see somebody. But other than that, it's probably just due to aging. Mm-hmm. All right?
Oxidation.
Yes. All right. Good one. I like old Boone. He's a good.
He's good.
Here's a Stacy DeLoach one from 2021 that we never answered. Let's see. I'm just doing these blind, so.
Hello, Dr. Steve.
Hey, man.
Hello, Dr. Scott. Miss you, Casey.
So,
Hey, I may not have enough information for a good question here, but
Well, when's that
We'll
ever
make it up.
stopped?
every once in a while I can turn my head and my neck will pop.
Oh, that's
Is
a good
that
one for
nothing
Scott.
more than just like me popping my knuckles or popping my toes?
There you go, Scott. That's one for you.
well, it's probably because his head is so big and full of all those brains.
Okay,
He's just
whatever.
an enormous amount of weight.
Let's answer
there.
the question, Jesus Christ.
I can't say something smart ass.
No, you can't.
Anyway,
You have to
so
be good
what
at
it
it.
sounds like is that when he's moving his head from right to left, he could have just a little bit of arthritis in his neck. He could have some really tight muscles, and tight muscles will pull those vertebrae closer together. So when you move your head from side to side, they'll snap, crackle, and pop. Now, rule of thumb:
What do we call it?
not always 100%, but
What do we call it when it makes that sort of grinding?
grinding.
Grind.
Crepitance. Crepitance.
Oh, well, I was
I
going
knew
to
you would
say
do that.
well, no, I thought it was grinding.
Yeah.
But
That's what they call it in traditional
that's
Chinese
right,
medicine.
grinding. But rule of thumb, not 100% of the time, but as a general rule, if you move it once and it pops once, that's normal. If you move it and it continues to pop every single time, then that could potentially be something to be concerned with. And certainly, if you do that and you have shooting pain,
Right.
that's a major.
Well, my thing is always when I crack my neck, it's always my facet joints. So the facet joints in the neck are where the back of the vertebrae join together, and they're just sort of little platforms where they sit on top of each other. And there's the smooth surface on the end of that, and it's that's covered in cartilage. And then inside that is synovial fluid, just like every other joint has, there's beautifully clear fluid. It's unbelievable how clear it is when it's healthy. And then when you rub together these things and you can put enough pressure on them to actually release dissolved gas, and it releases all at once into a bubble, and then it gets resorbed, then that's like cracking your knuckles,
Right.
popping your neck, same thing.
Yeah.
That's the way I envision it. When you hear that pop, 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 pop when you move your neck.
Yeah, and it's not uncommon, Dr. Steve, for those facet joints, because those facet joints approximate. They keep the vertebrae in a relative line.
Correct.
And and it's not uncommon for them to get just a little bit out of alignment, and when you turn and they either pop back into alignment, which is
it feels good too.
It can feel great.
That's why chiropractors, have jobs.
Oh yeah,
because
heck
that
yeah.
feels so good when they do that.
No bone crackers.
I want to do a quick shout out to my buddy B Dabbler. He's also known as El Horrible, and he does a show on YouTube on Sunday nights called Tukey Soup. That is, I can't miss it. It's one of my favorite things. And
Oh,
Be
cool.
Dabbling Live. Trucker Andy from WATP said Be Dabbling Live, which is at 10 a.m. Eastern on YouTube, is like what is adult Saturday morning cartoons. So check out his YouTube channel. And he's in the Fluid family right now and sent us our first super chat. So that's very cool. Not
Thank you.
asking for super chats. I'm just, giving a shout out to a friend. Got to hang out with Mr. Bedabbler. Myrtle calls him. She calls his show, but doesn't know to turn her radio down. And there's always a horrible delay, and nobody can understand anything. And she thinks it's swap shop.
Oh my
Anyway,
God.
she's trying to sell her items, but she calls him Mr. Bedazzler.
Oh my God.
You surely do have a good show. So anyway, so check out his webpage or his YouTube channel. And I got to hang out with him and with Mr. Cardiff in Detroit. It was the highlight of the trip, to be honest with you. And all right. So anyway, all right.
Cool.
Neck cracking.
Neck cracking.
Here we go. Let's see. Okay, now that's another Stacy one. Well, let's save that for next time. All right, here we go. This is another one from 2020.
Hey, Dr. Steve. It's
Hey.
Pete in Connecticut. What's going on, man?
Hey, man. How are you?
Yeah, chilling.
Good.
Listen, this might not be your immediate expertise, but I was thinking, why the hell do we have butt cheeks? Every single other animal on the planet just has an asshole and the open sky. And we've got these two meaty things that are a pain in the ass to clean, get all swampy and itchy.
Yeah.
What the hell are they doing there? Thanks, bye.
Well, one difference is that we walk on two legs. So you need those muscles to help hold us
Stand
erect.
upright.
The gluteus maximus attaches to the upper part of the pelvis, which is called the ilium, and that allows for stability and it helps keep us balanced. And then the other benefit to it is we can sit, and we've got some cushion that we can sit on
and enjoy sitting in.
Yeah, I think we're the only animal that mostly walks on two legs, but also just sits on our asses. I must feel weird for a chimp though, because they do sit and they can walk a little bit on two legs. They don't like it, They like to walk forward with their hands, but it must feel weird just to have your asshole just sitting right on the ground. He's right about that. Now,
Well, they have a tail too, so sitting may not be as
chimps
comfortable.
don't. They're
Well, I was just thinking monkeys.
Oh yeah, well monkeys
Yeah,
do.
okay, yeah.
But monkeys don't sit on their tail though. They'll sit on a branch with their tail behind them.
Kind of flopping over. Yeah.
Yeah, it's not like they curl up their tail and go, "Ooh, I'm going to make myself a cushion."
A little spring.
Yeah, we have big butts. It helps us stand upright and helps us balance when running and walking. And the other benefit is that, we have a few more muscles, I guess, to allow us to be continent. And there's a survival advantage when you're trying to avoid saber-toothed tigers, that you're not just dropping loads everywhere you walk when they can just track you because of your stupid, bowel movements flopping out on the ground. I guess that's, but yeah, that's mostly because we walk upright. Tacey, you got anything?
Nope.
Okay. Now I'm looking at an article that says, which came first, the big butt or upright walking? Well, there are other, primates that do some upright walking. So I would say that, that we evolved from something that was walking some of the time. And this researcher says if big butts had come first, they would have actually impeded the act of walking. Early hominids would have had to start walking upright before developing big butts. So,
well, that makes sense.
Yeah, and the irony is that even though we sit on them for alarming amounts of time during the day, that they developed so that we could stand up straight. So there you go.
That's wild.
Well, that's a good
word, wild stuff.
All right, I'll give the listener a bell for that one. Nobody's got.
Give thyself a bell.
Forgot about bells.
Yeah, I did too. All right, here's another one from 2021.
Hey, Dr. Steve. This is John from Rhode Island.
Hello, John.
How are you doing today?
Hey, doing okay, man.
Oh, that's a shame. Maybe tomorrow will be better.
Oh, okay. Wait a minute. Let's do that again. Hang on. I fucked that one up.
This is John from Rhode Island. How are you doing today?
I suck, man.
Oh, that's a shame. Maybe tomorrow will be better. Listen, I have a question about restless leg syndrome.
Okay.
So, I'm not sure if I have it. I've never been diagnosed with it. But I do get this weird sensation in my legs where I feel like they can't stay still, and I have to move them.
Yeah.
And I get like pins and needles. And from what I've read, that sounds like restless leg syndrome.
Sure does.
And I'm curious, is there anything at the moment I can do to alleviate it so that I don't have to deal with it all night? Thank you.
That's the worst. It's awful to have that.
Yeah. Now, you had it during pregnancy, right?
Mm-hmm.
Yeah. You want to talk about it?
Well, I took Benadryl.
Okay. Okay. You took Benadryl and it caused it, or you?
It took care of it.
Oh,
okay.
Better. Okay.
All right. So talk about your symptoms, Taze.
Yeah, you just can't. I mean, you can't sit still. You can't. You're laying there and you can't not move them. And pins and needles, exactly how he described it.
Yeah.
It's miserable.
Yeah, and you only get relief with movement, like stretching, jiggling your legs. Now, there is a thing called periodic limb movement disorder. That's it's related but different. You can get nighttime leg twitching. And it's described by people as compelling and unpleasant. That's the thing. It's usually bilateral, in other words, both sides of the body. It's very rarely affects things like the arms. And people will feel crawling, creeping, pulling, throbbing, tingling, as you all said. And a lot of times the sensations are difficult to explain, which actually helps you to make the diagnosis, Don't know what causes it. Might run in families. Pregnancy absolutely is a risk factor, and when you deliver, it tends to go away. And it is very difficult to deal with. So, what you can do is, if you treat an underlying problem, it could fix it. So, pregnancy is one. Iron deficiency is one. So iron supplementations help some people who have iron deficiency. It'd mostly be women with heavy flow and that not so fresh feeling. But then you take iron and it helps. But there are medications.
Hang on, before you get to the medications, I was just going to say another supplements too. Sometimes magnesium can help a little bit. Sometimes like a B complex if it's a mineral deficiency.
Exercise,
and don't forget too. Sometimes it can be a spinal thing, like a spinal stenosis. So narrowing of the canal can give the same restless leg syndrome.
Sure, you would think they would have other symptoms with that, like pain down their leg or something, but maybe not.
Maybe not. Yeah,
but you want to get seen.
Least, and I think that's the key to treating it is do your best to identify what the actual cause is, but you don't always get to figure that out too.
Right. So it's fatigue worsens it. So you have good sleep hygiene. Go to bed at the same time every day. Get up at the same time. Exercise, not right before bed though.
Nope.
And don't overdo it. And again, not too late in the day. And then no caffeine at night, and maybe cut out caffeine altogether. You can use a foot wrap. They have vibrating pads that you can buy for this. You could take a hot bath before you go to bed. Well, don't be ridiculous. I mean, don't burn yourself, but warm bath. Heat and cold packs may help. And just don't resist the need for movement. That's going to make things worse. So, and then just get help. But Scott, so any sort of needling that you can do for these people?
Yeah, sometimes actually acupuncture can help. Just doing the needles down the legs will stimulate blood flow and will help to calm down the restless legs at night.
Okay.
Sure can.
Yeah, and then there are medications.
Sure.
So there's one called Pramipexole or Mirapex. There's several other ones that we can use. You can use Lyrica or gabapentin. Those affect calcium channels, and those are known for neuropathic pain. It kind of makes sense. Times they'll give them muscle relaxers like Klonopin or something like that, but those are habit forming. Right. Opioids can be helpful as well, but those are also habit forming, and that's a dead last resort because you're going to end up with other problems with that. So, but anyway, get some help. Get some help for that. 3 years later. All right, that's from 2021. Let's hit one. You got anything else from the fluid family?
No.
Okay. All right. Let's run down to. Let's go. I need one of those drops with the harp, so it sounds like we're going back in time. Let's go back in time to 2015 and see what this guy's got. I know.
I have constantly athlete's foot.
What?
I have either itches or I scratch it until it bleeds.
Okay, he's got athlete's foot. We're running out of time, and his audio is terrible. Athlete's foot very often caused by a fungus. Refractory athlete's foot might not be athlete's foot. It could be psoriasis or something like that. So if you've tried the over-the-counter antifungal creams and try 2 or 3 of them, there's ketoconazole, but there are other ones. There's terbinafine, and sold by different names. And if you don't get any relief from that, see a dermatologist or even a podiatrist. Podiatrists are pretty good at this stuff. But, Scott, you got anything for athlete? You were an athlete.
Yeah.
Wearing the right kind of socks.
Keeping them dry. Keeping your feet dry, not letting them get moist.
Get wicking white socks and wear those.
Yep.
Anything else you can think of on that?
Yeah, not wearing. Sometimes you have to wear sandals into the shower, so that you don't pick it up. Yeah,
you're not picking it up.
And then, for God's sakes, don't wipe your feet and then wipe your junk, because then you're going to transfer your fungus.
Yeah, you know what?
Among us.
Oh.
Give thyself
That's
a
what
bell.
I'm talking about. Woo!
Okay, Tacey, you get a retroactive bell for.
Oh, bullshit!
Give thyself a bell.
That's terrible.
There you go. Well, listen, thanks always go to Dr. Scott. Thanks to everyone at SiriusXM whose steadfast support of the show sustained us over the years, particularly Lewis Johnson, Jim McClure, Sam Roberts, James Norton, Travis Teff, Troy Hinson, Paul Opcharski, and Roland Campos. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. All right.
Good stuff.
All right. Wow, Lady Trucker's in here?
Yeah, man.
Wow.
Old satchel ass.
You remember that drop we used to have? Hang on to the wheel, Scott. I got to take a shit. Do you remember that?
No, I don't.
When not Scott, it was Todd. Todd was going to go do when we were doing trucker duty, the trucker duty bit. This may have been before your time.
Yeah.
Jill, Lady Trucker, was going to take him on the road.
Okay.
And just so he could experience what being an over-the-road truck driver was like. And he was going to do some research at the truck stops about how people take shits when they're driving.
Okay.
And we did a whole long thing about it. That we had an insider named Barry the Blade who talked to us, and unfortunately, very sadly, died of influenza during swine flu. And he and Richard Smith, right, RDS, and his wife Shaddai became our examples why you need to have a flu shot, because Richard almost died and Barry the Blade did die. Yeah. But anyway, there was an audio drop that, let me see if I can find this. We're not doing show right now. Let me see. Oh, here, I found it. Lady Trucker, I hope you're still out there. Hang on. See if I can.
Hey, folks.
What?
Got a little bit of an oddball question
that's not
for
it.
you.
Hang on.
Fingernails on a chalkboard.
Stop. Why can't I get this to play? Open with Ampado Pro. There you go.
I don't know.
Huh. Okay. It's here. Let me open it with something else. Let's open it with the music app and see if that works. There you go.
Hold the wheel for a minute, Todd. I gotta take a shit.
We said that was going to be in his nightmares. Lady Trucker's the best.
I love it.
Let's see. We have, I don't know what's going on with the MP3s not playing properly.
It's G-Vac's Big Gay Haircut.
Do you remember that? I don't remember that bit. You do?
What did the term?
I don't remember G-Vac's Big Gay Haircut.
Well, a good old long time ago.
Yeah, sure was. Let's see here.
When my mom is a my daddy goes to asleymedicine.com. There he can lots of other women. When I grow up, I'm going to be an Ashley Medicine man. Because my daddy's raising me without any moral compass whatsoever. Ashley Medicine, find your lovers here. Why exactly are we singing this? Daddy, what's a rotisserie?
What? Did you say what? Let me see.
I love it.
I'm finding all kinds of stuff in there.
What's
Steve, Dr. Steve.
Don't we need to do the beginning?
Yes.
Listen up there, tough guy.
It's almost football time in Tennessee.
I mean, let's go.
Okay. All right. Jesus.
Football time in Tennessee, baby.
All right. I thought we were having fun. I guess not.
Oh, it was fun. The kid part's fun.
All right. Okay, so we're going to do Riotcast. Not Riotcast. Okay, we got to do an ending, too. You want to do? You have no other questions to do?
No.
Okay,
nope.
so we'll just end it here then. I noticed on camera that I sit there with my mouth open too much like an old man.
Open mouth breather.
Yeah, so I gotta stop that. Okay. All right. Well, thanks always go to Dr. Scott. Thanks to everyone who's made this show happen over the years. Thank you, Tacey, for being here, and thanks for Topic Time. Listen to our SiriusXM show on the Faction Talk channel. SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. I don't know what I thought I was going to say there. All right, and then let's do the opening.
Can you, shut up? Can you, shut up?
You get nothing. You lose. Good day, sir.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain now and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios in beautiful downtown Bedabbler City, it's Weird Medicine. First and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider. Gives me street cred, the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my wife, Tacey, our partner in all things. Hello, Tacey.
Hello.
This is a show for people who have never listened to a medical show on the radio or the internet. If you have a question, you're embarrassed to take to your regular medical provider. If you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at drscottwm. Visit our website, drsteve.com, for podcasts, medical news, and stuff you can buy. Go to our YouTube channel, youtube.com/@weirdmedicine. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. Check out stuff.drsteve.com. That's stuff.drsteve.com for all of your shopping needs. The holiday season is coming, and you can just go there and scroll down and buy stuff we talk about, or you can just click through to Amazon. It really, really helps. Thank you very much for using that. One of the things that you can get for one of your musician friends is the Rody robotic tuner. They're very inexpensive for what they do. It's ROADIE.drsteve.com, or you can just go to stuff.drsteve.com and scroll down. Check out tweakedaudio.com. No clue whether we're still getting anything from that, but the link still works. Offer code FLUID will get you 33% off anything that they are selling, and they are a Tennessee company. I didn't even know that until, I think, last year. Check out Dr. Scott's website at simplyherbals.net. And we're doing Patreon again, so patreon.com/weirdmedicine. Did a live stream for Patreon on the worst medical malpractice case I've ever seen. And just spoiler for that, it's tragic, it's horrendous. We talked about how it could have possibly happened, what they could have done to prevent it, and their reaction, and the media's, frenzy and all that stuff. So check that out, patreon.com/weirdmedicine. Tacey and I will do shows on there as well, but there's exclusive content. And then if we do a live stream, it will be on Patreon. A lot of them will be on Patreon first, so Patreon gets a first look at the regular YouTube live streams. And don't forget cameo.com/weirdmedicine. I dropped my price to $2.
Oh, my goodness.
No, I'll tell you why.
Bargain of the century.
No, I'll tell you why. Because I got 1 million of them. And, Tacey, you're going to laugh at this. I was on the leaderboard, so like if you do more than a few of them, they go, "Oh, you're on the leaderboard." Guess who I was one above?
Who?
Darcy Silva.
Oh, no.
Yes.
Really?
So, she has to obsessively be looking at where she is on the leaderboard on Cameo. And it's like, well, who is this weird medicine? It's so funny. For people who don't know, well, just Google Darcy Silva. You'll know. She used to be really cute, and then she got on reality TV and had way, way, way too much work done, in my opinion. I'm sure she's very happy.
She's even
with
had
herself.
more. I saw a picture of her yesterday.
Oh, my goodness. So, yeah, she was...
She looks good. You would not recognize her.
Yeah, right. And when she and her sister were young before the plastic surgery, they were very cute, and now they're just extreme, and maybe that's what some people are looking for, But anyway, and no flies on it. Do whatever you want to do. I'm fine with it. You do you. But I thought that was funny that I was one above her. So.
That is funny.
I almost took a screenshot and sent it to you because you're the only person I know that would get that. But anyway. All right, very good. Anything else?
Nope.
Okay.
Nope.
All right.
Do you need this on?
Yes, please. I think we'll play one.
Only one?
Or two or three.
Do you?
Depends on how many I ruin.
You have a game you got to go to or something?
No, I'm not playing. But there's a game coming on here in a bit.
Alabama.
Yeah.
Now, did you get my message about? Where's that coming from?
No, that's me. Yeah.
Oh, yeah.
Yeah.
Did you get the message about my idea for the symphony?
Yeah. Yeah.
To do the Philip Glass thing.
Yeah. And I didn't ask her. I saw her yesterday, and I'll see her again this week. But
I would love to be the narrator of that.
So what exactly you want to happen?
Well, to see if the symphony wants to do it.
Okay.
I mean, as a part of their repertoire. Yeah, it's an opera. But I mean, so there would have to be a chorale, but the symphony would play the music part.
Okay. Gotcha.
Or maybe just do one part of it.
Gotcha. Yeah, I'll talk to her. I'll see her. And actually, they've got a symphony coming up next Sunday. A free one over at the Farmers Market.
Yeah.
It's actually pretty good.
But yeah, I'm learning the Glassworks opening thing, and it's all 3 against 2, and it's very difficult to play.
Huh.
And but I will learn it by next month. I'll have it down. But anyway, all right.
Huh. That's interesting.
But first, a number. That's correct, Richard. It was okay. So Awaste Jill said it sounded like Dr. Steve said nutwork. Much more gooder than network. I don't disagree. Nutwork is delightful. Thanks, Bedabbler, for the $9.99. When did you get monetized? Congrats, Dr. Steve and crew. What a good boy. I send Bedabbler so much money through Myrtle, and I've got another persona that sends stuff. So it's only fitting that he gave us our first super chat.
That's cool.
And there's Amy. I see Amy in there. Thank you,
Yeah.
Amy.
Sweet Amy.
Oh, okay. Iwasti Jill is Lady Trucker. Okay, I got you. Okay, now I got it. Yeah, we had a whole thing with Lady Trucker when
Todd was around.
something was going on in her personal life.
Oh, yeah.
Okay, here we go. Good. Okay, so Goody Two Shoes, this would have been a good one for you to have read, but it's okay. The FDA Adverse Event Reporting System has received at least 489 reports of patients experiencing anxiety, depression, or suicidal thoughts while taking drugs like Ozempic. Yes, there. Now, millions and millions of people have taken these drugs,
Sure.
and this is in phase 4 when you find these very rare effects. So 480 out of 400 million people is, like 1 in a million, but it is rare, but it is a known effect, and it needs to be put in the informed consent for people so that they are aware that this is a possibility, so that they'll do something about it.
Right on.
At least seek help if this is a problem. So, but this looks like a real effect.
Cool. A couple of pretty flowers, one I brought to you. Nope. Couple of pretty flowers, one I brought to you.
Yeah, you can sing it like that. Sing it down in that voice.
There was a song. Oh, Grateful Dead. What I hear coming over here that has a big keyboard. Let me think. I'll think of a second. That you should know. What did I listen to? Going, doggone it! Oh, I was gonna say, man, you could play the keyboards on this Dead song I had coming over here.
Yeah, what is it?
Well, I'm trying to think what it was. I'll think of a second. Boys are doing okay?
All right. What are we playing?
How about a little,
I can't find a good sound on that I want to use, so.
how about a little how about Mama Tried? Old Merle Haggard.
Okay.
Let me see. Where to put that old song at?
Do you see we got a copyright claim on our Bertha? That means it must have sounded like Bertha.
Bertha means it was actually sounded
We
like
got two of them.
Oh, I love it.
Yeah.
So who was it? Just so somebody owns that?
Yeah,
section
it's
on
like the publishing company.
Gotcha.
Okay.
In D?
Yep.
First thing I remember knowing was a lonesome whistle blowing and a young and thrilling going up and right. The freight train leaving town, not knowing where I'm bound. No one could change my mind, but Mama tried. One and only rebel child from a family meek and mild. My Mama seemed to know what lay in store. Friday, Sunday learning. Towards the bad, I kept on turning. No, don't help me anymore. And I turned 21 in prison, doing life without parole. No one could steer me right, but Mama tried to raise me better, but he denied. There's only me to blame, but Mama tried.
Okay, I got it.
Yep.
Okay, let's get you some reverb.
Yeah, give me some reverby. The more the better. Test. One and only rebel child. One and only rebel child. First thing I remember knowing was a lonesome whistle blowing and the young'un's dream of growing up to the ride. On a freight train leaving town, not knowing where I'm bound. No one could change my mind, but Mama tried. One and only rebel child from a family meek and mild. My Mama seemed to know what lay in store. In spite of all my Sunday learnings, towards the bad I kept on turning. The Mama couldn't hold me anymore. And I turned 21 in prison, doing life without parole. No one could do me right, but Mama tried to raise me better, but her pleading I denied. There's only me to blame, but Mama tried. Dear old daddy, rest his soul, whose Mama heavy load. She tried so very hard to fill his shoes, working hours without rest, wanted me to have the best. She tried to raise me right, but I refused. And I turned 21 in prison, doing life without parole. No one could steer me right, but Mama tried to raise me better, but her pleading I denied. Now there's only me to blame, but Mama tried.
Okay, I'm fucking that up. Okay, the chorus
is
Okay, let's do the chorus once, and then I got it.
Here, it's the B minor, and it's just a little.
No, it's okay. No, I got it.
So let's go to the chorus in 3, 10. 21 in prison, doing life without parole. No one could treat me right, but Mama tried to raise me better, but her pleading I denied. That leaves only me to blame, but Mama tried.
No, I'm still messing it up. Do it again.
Yep, that's good. And I turned 21 in prison, doing life without parole. No one could steer me right, but Mama tried to raise me better, 99. Allie's only need a blame, but mama tried.
Yeah, I got it.
Turned 21 in prison, doing life without parole. No one could steer me right, but mama tried. Mama tried. Mama tried to raise me better, but her bleeding I denied. There's only me to blame, but mama tried.
Okay, I got it. Okay.
What a great little song, isn't it?
Yep, it's a good one. Okay, I got it. Sorry, I fucked it up.
No, it's okay.
All right.
Is that B minor? It's just a
No,
little
no,
weird.
no. It's fine. That wasn't it. It was the structure of it.
Oh, okay. It could be me changing the structure every time we play it.
Maybe.
The first thing I remember knowing was a lonesome whistle blowing, and the young ones was dreaming up to ride on a freight train leaving town, not knowing where I'm bound. No one could change my mind, but mama tried. One and only rebel child from a family meek and mild. Mama tried to see what lay in store. In spite of all my Sunday learning, too bad I kept on turning. Mama couldn't hold me anymore. And I turned 21 in prison, doing life without parole. No one could see me right, but mama tried. Mama tried. Mama tried to raise me better, but her pleading I denied. That leaves only me to blame, 'cause mama tried. Dear old daddy, rest his soul, said mama heavy load. She tried so very hard to fill his shoes, working hours without rest, wanted me to have the best. She tried to raise me right, but I refused. And I turned 21 in prison, doing life without parole. No one could steer me right, but mama tried. Mama tried. Mama tried to raise me better, but her pleading I denied. That leaves only me to blame, 'cause mama tried. And I earned 21 in prison, doing life without parole. No one could steer me right, but mama tried. Mama tried. Mama tried to raise me better, but her pleading I denied. Leaves only me to blame, 'cause mama tried. That leaves only me to blame, 'cause mama tried.
That's good. Now listen.
Yeah.
When you play the instrumental part,
Yep.
you've got to follow either the verse or the chorus.
Not just make one up.
I can't follow you if you just randomly
I know it.
go from the D to the G.
I started on the verse.
You started off
and I
doing the
carried-
chorus, and then you ended up doing the
verse.
second part, doing the verse, which is fine. If you tell me that's
Well, if I
what
tell
you
you
want to do, I'm okay with that, but it's hard to
no,
follow.
that's my fault. Yeah,
Anyway.
I kind of screwed up.
Yeah, that's good. That's a good one.
That's a
Put
great
that
one.
on the list.
Yeah, I'll put that on the next to-do list. Yeah, we're gonna play a little joint over here close to the house.
What?
Eventually, we're not gonna do it anytime soon, but let's do a Waylon Jennings. Let's do a America.
Okay, I
America.
don't know that.
We played it. We played a couple months ago. It's
We
in
did?
G.
Okay.
It's some have said, down through history, if it lasts, it's a mystery, but I guess I don't. Some have said, down through history, if it lasts, it's a mystery, but I guess I don't know what they're talking about. From the mountains down to the sea, you become such a habit with me, America, America. Does that ring a bell?
Yeah, but what key are you playing?
It's the intro's in G, and then you just hold the G. So I think, Steve, I think it's C, because the actual "Some Have Said," so it's actually the "Some Have Said" is actually in a C. The very first.
That's
some,
not the one I have. Okay.
but it's got G just above the word "some."
Well, okay.
No. So I'm asking.
G is the fifth of C.
Right. So, what
so
I'm saying,
if there's an F in here, then it is There's an F and an A minor.
Then
that's a key of C.
Correct.
Gotcha.
Gotcha. So it's a C.
All right.
Yeah. So it's
Very
just
good.
the strum and the G. So it's technically in C. Right.
Well, it just starts with the fifth. So
Yeah,
do,
okay,
do,
yeah.
do, do, do. Some have said.
Well, some have said, some have said, down through history, if you last, it's a mystery. But I guess I don't know what they're talking about. From the mountains down to the sea, you become such a habit with me. America, America. Well, I come from down around Tennessee, but the people in California, they're nice to me. America. It don't matter where I may roam, tell your people it's home sweet home, America, America. And my brothers, they're all black and white, yellow too. And the red man is right to expect a little from you. Promise and then follow through, America. All the men who fell from the plane and through hardships and pain, America, America. And the men who could not fight in a war that didn't seem right, you let them come home, America. And my brothers are all black and white, yellow too. And the red man is right to expect a little from you. Promise and then follow through, America. Well, I come from down around Tennessee, but the people in California, they're nice to me, America. It don't matter where I may roam, tell you people it's home sweet home, America, 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 America. One more time. America, America. What do you think? Yeah, I like it. It's a great little patriotic song.
Yeah, it's very jingoistic.
I like it.
Americana. What else you got?
I know you love it when I do this. Do you want to try a new one, Dr. Steve?
Well, that is a new one. Yeah, put that on our list, too. Might as well play songs that we can actually play.
Yeah, well, I think anything in Waylon Jennings I can get semi-close to.
All right.
Semi-close.
Yeah, what else you got?
There's a song by Whiskey Myers called "Broken Window Serenade," and you'll love this. He wrote it about a girlfriend who becomes a meth head and dies.
Good.
It's a pretty good song. So it's in C, C as well, and it's pretty much C, E minor through the whole song. Okay. So you can just noodle the whole time, but the rhythm is kind of.
I don't want to noodle. I'm gluten sensitive. It's not a C. That's a C add 9. That's a C with a D note added in.
It's right here. This is the D. This is the D right
here. There you go.
what I brought to you. I saw you through a broken window from a different point of view. Hang on, give me just 1 second. Let me get the, I'll get the time. A couple of pretty flowers, what I brought to you. Let me wait. I don't want to do that right now, Stevie. I thought I had it in my mind, but I just don't. Yeah, I'm sorry. Let's go back. Let's do something we can finish, and I will get that song. It's a beautiful tune.
Is it?
If you like, kind of, death by meth songs.
Yeah, I love them.
How about? Let's do something by old Doc Watson. About. I'm looking it up right now. Let's do. Is there any requests in the?
No, they don't. They want us to. Their request would be for us to play "Far, Far Away."
You mean not?
Not
the
the song.
Not recorded. Oh, yeah, not recorded.
Not the song "Far, Far Away."
Somehow I managed to turn the YouTube channel. Delete that. How about "Sitting on Top of the World" by Doc Watson?
Okay,
it's an E. We can do that. Different point of view. Roy Clark and banjo. That's what we need is Roy Clark.
What about something like some of the old Carter stuff, like "It Ain't Me, Babe" and stuff like that?
It ain't me, babe. Like a.
It ain't me, babe.
Oh,
no,
Bob Dylan stuff.
Well, yeah, the Carters did it too.
It ain't me, babe. Or Sonny and Cher.
No, we could do the Turtles version. That was a good one.
How about "It Ain't Me, Babe"? Bob Dylan.
"Sitting on Top of the World." I thought we were doing that.
We are, yep. In E.
Yep.
Was in the spring, one sunny day, sweetheart left me, she went away. Now she's gone, I don't worry, 'cause I'm sitting on top of the world. She called me up for an up in El Paso, come back, Daddy, woo, I need you so. And now she's gone, and I don't worry, 'cause I'm sitting on top of the world. Don't like my peaches, don't shake my tree. Get out of my orchard, let the peaches be. And now she's gone, and I don't worry, 'cause I'm sitting on top of the world. I'll get to sing it. Here we go. You know, I'm in here holding at your hand. Gonna get me a woman like you got your man. And now she's gone, and I don't worry, 'cause I'm sitting on top of the world. 'Twas in the spring, one sunny day, my sweetheart left me, she went away. And now she's gone, and I don't worry, 'cause I'm sitting on top of the world. One more time. 'Twas in the spring, one sunny day, my sweetheart left me, woo, she went away. And now she's gone, and I don't worry, no, 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 'cause I'm sitting on top of the world. 'Cause I'm sitting on top of the world. There you go. I killed you again. I'm sorry.
Yeah. Okay.
That's-
So
that-
let's
and
just
that's
agree.
totally- yeah.
Let's just agree that if you're going to do the instrumental, you just look at the words and just
play
don't
straight
sing
to
the
it.
words and play it. Play that. Don't play what the notes down there because you're getting confused.
Yeah, because I screwed it, and I knew it as soon as I did. No, then the guilt started creeping in.
No, it's
because I knew there's no way you could play that if I'm out playing nothing.
Yeah,
and
just
nobody knows
play
what
the
I'm
same
doing.
structure.
Yeah,
but
well, yeah.
So look at the verses.
Yeah.
And don't look at the instrumental where it's just got a string of chords.
Dang it. Yeah, that's so my fault.
All right.
You want to do? You'll do it one more time, and we'll get out of here.
Yeah, I do that.
Go watch a little football. Yeah, it's just such a great little song, and
Yeah.
I'll play the break just exactly like the verse.
There you go. Because you do good on that.
You would think after 5 years. Now here you go. Hey, Dr. Steve, how about a little old Doc Watson tune today?
All right, let's do it.
How about let's do a little how about Sitting on Top of the World, I think.
All right.
Okay, here we go. 3, 2, 1, and "'Twas in the spring, one sunny day, my sweetheart left me, she went away. And now she's gone, and I don't worry, 'cause I'm sitting on top of the world. She called me up from Mountain El Paso, said, come back, Daddy, woo, I need you so. And now she's gone, and I don't worry, 'cause I'm sitting on top of the world.
Remember it goes.
The conversation we just had.
E7. A.
Fuck. I know.
A. Just sing it in your head. Just sing the words in your head, and then you'll play it right. Just don't vocalize.
No, I won't. Yeah.
Even if you have to whisper them or something, and then you'll get the structure right every time.
Yeah, let's just do verse 2, and then the instrumental.
I'd like to put this up on YouTube if we could do it right.
No, we'll. I swear, I won't screw it up.
We'll do it next time.
No, let's do it. Let's do it. I swear,
Okay,
I'm not going to screw it up. I swear. So, hang on. Let me get. God dang it! I swear. All right, here we go. All right. So we're going East. Oh, hold one second. I just moved my whole screen out.
E to E7.
Yep. So here we go.
Okay, 1, 2, 1, 2, 3.
Here we go.
That was a B. What was that?
That was a B sharp. That's a B. Okay, all right.
Sing it in your head, like.
No, that was just me missing a fucking
sunny day.
Here we go. All right, here we go. 3, up.
2, 1, 2. You got me messed up. 1, 2,
Sorry, brother.
3.
Was in the spring, one sunny day, my sweetheart left me, she went away, and now she's gone, and I don't worry, 'cause I'm sitting on top of the world. She called me up from El Paso, she said, come home, Daddy, woo, I need you so. Now she's gone, now don't worry, 'cause I'm sitting on top of the world. Don't like my peaches, don't shake my tree. Get out of my orchard, let my peaches be. And now she's gone, and I don't worry, 'cause I'm sitting on top of the world. Don't come round here holding at your hand. Gonna get me a woman like you got your man. Now she's gone, I don't worry, 'cause I'm sitting on top of the world. Was in the spring, one sunny day, my sweetheart left me, Lord, she went away. Now she's gone, I don't worry, 'cause I'm sitting on top of the world. Now she's gone, I don't worry, 'cause I'm sitting on top of the world.
I missed the ending there. I didn't know where you were going with that.
You know, and then the whole time you're like, your hands start sweating. You go like, oh God, I'm gonna screw it up again. And then my pick started moving away, and I was playing with my fingernails. It was terrible. Oh my God. Well, thanks, Dr. Steve. That was fun.
That was fun.
That was fun. It was good. And a couple good old tunes.
Yep.
King of Diffs. What do you think, man?
Cletus is going to be on Perry this week. Now, Mr. Carton Valley, you aren't not to be looking up Aunt Myrtle's petticoat like that. You know, that ain't right for a man to be doing that to an old widow woman. I don't know. I need to get him like a corncob pipe.
Oh, Lord. That's funny.
Well, I don't know. I don't know if it's funny. It's obnoxious. Oh, all right. Thanks, everybody.
Thank you guys.
Anything? Ooh.
See you all in a week.
Wow. Did you read what King of All Diffs said? He said he was riding his bike on a road that's been under 25 feet of water from 68. Wow.
Yeah, that rain we had this week yesterday was the only rain we've had in months.
Okay, Goody Two Shoes says Spanish Guitar by Gene Clark. Do you know that one?
No, I don't, but I wrote it down. I wrote it down to look at it. I sure did. Okay. Yeah, I'm uncertain of that song, but I certainly will.
Okay.
Yeah, I'll have a look at this evening. So it's going to go.
Medicine's answer to Roy Clark and Buck Owens. Whatever.
That's right. You're damn right. They've got some skills we don't have, and vice versa.
Oh, e-waste Jill. Fuck off. It looks like Awasti Jill. It's e-waste. It's electronics waste is in trash. Okay, e-waste Jill.
Although some kind of
Okay.
what's that reference?
Oh, King of All Dips posted a video. Okay, where is it? Is it on your YouTube channel? How do I find your YouTube channel?
All right, big boy. I'm gonna head on down the
Okay.
road there. I appreciate it. We're Oh, you know what I was gonna ask you? Well, did you save all this stuff yet?
Do what now?
Did you save the show?
No.
Yeah, let's save it first, I reckon.
Okay, I saved it.
My sweetheart left me. Lord, she went away. Now she's gone. And I don't worry.